This week we're going to cover the muscles of the thigh. Those muscles are the 3 muscles of the hamstrings, the 4 muscles of the quadriceps, the 5 muscles of the adductors, and the sartorius muscle and the tensor fasciae muscle. The hamstrings are located on the posterior thigh, and they cross the hip and the joints. They have a common insertion at the ischial tuberosity, which is your sits bones. The biceps femoris has 2 heads. It's the most lateral. The semitendinosus is the medial thigh, and it's more superficial, the most superficial, and the semimembranosus, which is deep to the semitendinosus. This picture shows the gluteus maximus and some adductor muscles here. You have the gracilis and the adductor magnus. You also have the hamstrings here. You have the biceps femoris, the semitendinosus, and the semimembranosus. And this is the lateral view and a medial view of those muscles. You can't see the origin of the hamstring muscles because it's covered over by the gluteus maximus. In this picture here, you can actually see some of the attachment sites here. These are the lateral hip rotators, so the gluteus maximus is cut away in this view. This is a medial view, and again you see the biceps femoris, the semitendinosus, and semimembranosus. You have the adductor magnus and the gracilis. And again, this is a lateral view of those same muscles. The biceps femoris flexes and laterally rotates the knee. It extends and laterally rotates the hip. These actions can be done together, or they can be done in unison so that you can flex your knee without extending your hip. The semitendinosus flexes and medially rotates the knee, extends and medially rotates the hip, and tilts the pelvis posteriorly. And the semimembranosus flexes and medially rotates the knee, extends and medially rotates the hip, and tilts posteriorly. The hamstrings, as I said before, extend over 2 joints, the hip and the knee. They can extend the hip and flex the knee at the same time, or they can do this separate. The tendons form the outline for the popliteal fossa. So if you look down at the posterior part of your knee, it almost looks like there's 2 bones on each side, the medial and the lateral side, and in the middle is the popliteal fossa, which is an endangerment site for massage. You have 5 muscles of the adductor group. Only one crosses 2 joints, crosses the hip and the knee, and that is the gracilis. The most anterior of the adductor muscles are the pectineus and the adductor longus. The middle is the adductor brevis, and the most posterior is the adductor magnus. This is a posterior view, and you see the adductor magnus and the gracilis as it crosses the knee joint here. All of the adductor muscles are attached somewhere on the pubis. There's in that general vicinity, they have individual attachment sites, but the general attachment would be the pubic bone. You see the adductor brevis here, the pectineus, again the gracilis as it crosses the knee joint, and the adductor longus. This hole right here is the hole for vessels, blood vessels, and nerves to pass through, and it's called the adductor hiatus. Hiatus meaning a hole. The adductors make up the tissue on the medial thigh, and again they fan out from the pubis down through the femur. Horseback riders have particularly strong adductor muscles because they hold on to the horse while they're horseback riding, so they grip the horse with their thighs to hold on. Anyone who pulls an adductor muscle, it's called a groin pull. Typically people pull those muscles up at the top near the pubis hence the name groin pull. The quadriceps are composed of 4 muscles. They insert into a single tendon above the knee, called the quadriceps tendon. The tendon connects to the patella before attaching to the tibial tuberosity on the tibia. There's only one muscle that crosses 2 joints, and that's the rectus femoris. The rectus femoris can flex the hip and extend the knee. The origin for the rectus femoris is the AIIS. The origin for the vastus medialis is the medial linea aspera. For the vastus intermedius, it's the anterior and lateral femur. And for the vastus lateralis, it will be the lateral linea aspera and the gluteal tuberosity. This is an anterior view showing the vastus intermedius, the vastus medialis. Again, you have the gracilis, some of the adductor magnus, the adductor longus, the adductor brevis, and the pectineus. I hope you're getting some idea of how closely associated these muscles are in the thigh, and they just sort of rotate from the adductors to the quadriceps to the hamstrings. Another view, the rectus femoris, and this is the quadriceps tendon, the vastus lateralis. This is a good picture of the sartorius. Again, the sartorius crosses the hip and the knee. It's also called the Taylor's muscle, and again, your adductor muscles on the medial side of the thigh. The distal end of the vastus intermedius forms an aponeurosis, and so remember, an aponeurosis is a broad, flat tendon, and depicted by this white colored picture here, and then it goes right over the patella and attaches to the tibial tuberosity. The quadriceps sometimes are referred to as one muscle with 4 heads. You will see that in some medical books. You will see that in some anatomy books. The vastus lateralis may be referred to as the vastus externus, the medialis as the vastus internus, and these muscles form the anterior, lateral, and medial aspects of the thigh. The last 2 muscles that don't belong into any group are the sartorius and the tensor fasciolata. The sartorius again crosses the hip and the knee joint. Origin is at the ASIS, and the insertion is the proximal medial shaft of the tibia. Because it crosses 2 joints, it's capable of hip flexion, lateral hip rotation, hip abduction, knee flexion, and medial rotation of a flexed knee. The tensor fasciolata does hip flexion, medial hip rotation, and hip adduction. The ITB, or the iliotibial tract, or the iliotibial band, as you will see it called, can be very sensitive, and especially in athletes. It extends pretty much from the greater trochanter all the way down to the knee. It's a superficial sheet of fascia, and it inserts on the tibial tubercle. The sartorius is also called the Taylor's muscle, and it's used to cross your legs. This is a good picture that shows the tensor fasciolata muscle, which is a very small muscle, but you can see how long the iliotibial tract or the iliotibial band is and how it inserts at the knee. An interesting tendon is called the pes anserinus tendon. This is also called the foot of the goose, and it's the flat spot on the proximal medial shaft of the tibia, and it's the merger of the tendons of the sartorius, the gracilis, and the semitendinosus. And so right here is a picture of the pes anserinus tendon.